The next slide will be post-procedural of non-accidental injury. Postmortem is included in the post-procedural because it is important to study the causes of the injury and to study the radiographic identification of patient. We can identify the patient by using the disaster. We use DVI to take some example from dental, paranasal sinuses, and the patient's DNA. In addition, forensic imaging is very important too because we can study the causes of the injury such as blunt trauma force, poisoning, environmental injury, asphyxia, and foreign bodies. Now we move to related anatomy. The related anatomy included some of the anatomy that is associated with non-accidental injury, such as classic metaphyseal lesion, posterior ribs, scapula, sternal angle, and skull. Intracranial injury is also associated with non-accidental injury. We should focus on their symptoms, especially if they show severity symptoms such as unexplained vomiting, irritability, and apnea. It is important for the imaging department to evaluate the non-accidental injury because we can provide the testimony and capable of withstand during the cross-examination in court. Non-accidental injury can also lead to internal injury. Internal injury can cause some damage and rupture to the blood vessel and the solid organ. And most importantly, the age of the bruise cannot be accurately determined from its color because the bruise color will not appear in the bruise until at least 18 to 24 hours after injury.
Common signs and symptoms of non-accidental injury (NAI). The example is bruises and abrasions, lacerations, scratches, soft tissue swelling, hematomas, which is the black clot within the soft tissue, trauma burns, and also the bites. Patient preparation for skeletal survey. First, before examination, normally there is no special patient preparation is required. However, if the patient was a female of childbearing age, the LMP should be requested. Second, during examination, patient must follow the radiographer's instructions. As there are various views taken, it is important for the patient to keep still during the examination. And lastly is after examination, the patient is asked to wait in the room. After evaluate the images, patient is allowed to leave the department.
There are two steps in order to detect whether the children have NAI or not. The first steps are involved in physical examination, and the second steps are investigation. The first step is physical examination. The diagnosis of physical examination is by looking at the evidence of abuse. It is including findings that raise suspicion, such as bruises, bite marks, and facial injury, and injuries inconsistent with the history. The second step is investigation. This is including laboratory investigation, ophthalmology, and diagnostic imaging such as skeletal survey, radionuclide, CT scan, and MRI. The first investigation in diagnostic imaging is the method of choice for global skeletal imaging in cases of suspected abuse. The American College of Radiology has published standards for skeletal survey imaging in cases of suspected abuse. So here is the list skeletal survey for NAI that should be taken. Here are some common sites of abuse. The images show the old posterior fractures, very indicative of neck. Skull also is the most common site of NAI. This image demonstrates textual fractures in a child who died of cerebral injury after being thrown off a height. This is a bone scintigraphy in an abused child with fractures of several ribs and of the right humerus and tibia. This is another radiographs of skull child abuse from CT. The child died due to the CNS injuries due to the hematoma in the interhemispheric region.
We can identify the patient by using the disaster victim identification. We use DVI to take some example from dental, paranasal sinuses, and the patient's DNA. In addition, forensic imaging is very important too because we can study the causes of the injury such as blunt trauma force, poisoning, environmental injury, asphyxia, and foreign bodies. Post-procedural of non-accidental injury. It is important to study the causes of the injury and to study the radiographic identification of patient. We can identify the patient by using the disaster victim identification. Uses DVI to take some example from dental, paranasal sinuses, and the patient's DNA. In addition, forensic imaging is very important too because we can study the causes of the injury such as blunt trauma force, poisoning, environmental injury, asphyxia, and foreign bodies.
Conclusion. Knowledge about this topic is essential if the possibility is not to be missed to protect a child from future neglect. At the same time, suspicion is necessary not because the implication for an innocent parent or guardian but for the accusations are illegal.